NHS in complete crisis at the moment because our government is so determined to sell it off to private enterprise, and this will be disastrous for us all. We don't want an American system. We want to get an NHS that works for all of us in the way it has done before. It needs to be funded properly.
Without the NHS, we wouldn't be anywhere because a lot of people are on low wages and couldn't afford to pay for their care. And I think it's a wonderful thing that we've got, and I think we've got to fight for it.
Don't close the A&E!
Safety in hospital!
Don't close the A&E!
Safety in hospital!
This government take everything away. They take our
trash and privatise!
maternity, and they close maternity, they close children ward. Now they want to close the accident emergency.
Save our Glenfield!
Save our NHS!
Save our Glenfield!
Save our NHS!
Save our Glenfield!
Save our NHS!
Back in 2012, the Tories and Lib Dems passed the Health and Social Care Act. It brought profound change to what we're all entitled to. It did away with the duty of the Secretary of State to provide a comprehensive health service in England, which is why Jeremy Hunt can just shrug his shoulders when you ask him what he's doing to your local hospital. It forces NHS services out to private competitive tender. So we're seeing private companies snapping up the stuff they want to do to give profits to shareholders and undermine the terms and conditions of hard-working NHS staff. And it allows NHS hospitals to make up to 49% of their money out of private patients. They never asked us if we wanted this, they just went ahead and did it. I think it's a national scandal. I believe the Tories are cutting supply in the public sector to create demand for a private health marketplace.
Healthcare, no welfare!
It's our NHS! Get your hands off it! It's not for sale! And it's not for profit! Altogether, it's our NHS! Get your hands off it! It's not for sale and it's not for profit!
We put about 8% of our GDP into healthcare. It's going to go down to 6.8% by 2020. Every other civilised country puts about 10%, 10 to 12%. So here's the chance. The NHS isn't overspent, it's underfunded by 20%. You ready? The NHS isn't overspent, it's underfunded by 20%. Our NHS! It's not for merging!
It's not for merging!
Keep it public!
Keep it public!
Kick out Virgin!
Kick out Virgin!
Our NHS is not for merging! Keep it public! Kick out Virgin! I'll explain the juniors condition in one chant, okay? 5-day staff won't stretch to 7. Bog off Hunt and bring back Bellon!
2, 4, 6, 8. Who do you appreciate? Our doctors, our nurses, our NHS.
The NHS Bill will reinstate the duty of the Secretary of State to provide a comprehensive free service paid for through direct taxation. It will stop NHS contracts going out to the market. It will reinstate the NHS to its founding principles, a state-planned, state-managed, state-delivered national health service organised to serve the needs of the population. The NHS Bill will put an end to the costly internal market brought in by Margaret Thatcher. It will introduce integrated health and social care, and it will transfer PFI debt to the Treasury so that hospitals can get on with doing what they're meant to do, treat patients.
Not your business! Not your business! Our NHS! Not your business! Whose NHS?
Our NHS!
Whose NHS?
Our NHS!
Whose NHS?
Our NHS!
Whose NHS?
I went through very hard labour when I was pregnant, and I had a lot of help, and I'm supporting all of the midwives helping me. That is very, very important for us, that we women and our children support this march today, because we can help to the women who will be going through the same thing what I did.
Not everybody can afford private healthcare, private medicine. I have friends in the States who have paid, sort of £30,000-40,000 just to give birth. And that's not something that I could do, That's my son and I wouldn't be able to survive or be well without the NHS.
My wife's American, and I've seen how much their system destroys lives, and we can't become that. So yes, we need the reinstatement bill, we need real public ownership of the NHS in all of the examples, and we need all profits taken out of it.
No ifs, no buts, no NHS cuts! No ifs, no buts,
spoke of people having the faith to fight a battle. I think he had in mind that there would be a fight, because I think he understood the forces at play in our country that want to stamp out the National Health Service. Keep campaigning for your local services. Everything you do is really important, but please just do one more thing. Go with friends, go with neighbours, take campaigners to your MP and ask them to publicly support the National Health Service Bill.